All right. Good afternoon. Sorry about the late start. We certainly have a lot of business going on and I know these bills take time and deserve time. However, we also want to make sure they get through before crossover day. So if everybody can be
under this railing in this corner, and this is the white carpet under their experience. And then we have my place,
mute
stage where we usually do like.
Anyway, so we are going to go on and get started. We have two bills to consider today. We'll start with House Resolution 768 with Chairman Hawkins. If you can come on up to the mic. Is that number one right there?
What number is it? 768. Oh, the LC number?
No, your microphone. Looks like you're on. You're on.
Witness one.
You're on.
You got it? Yeah.
Thank you for being here today.
Yeah. Well, good afternoon. I won't take a long time. I know that time is late and people are tired. This resolution calls for a study committee to look at expanding long-term care options. You know, as we know, we've just gone through 2 years of a pandemic, which was devastating to many people, and especially to the folks living in nursing homes and long-term care facilities. Lost a lot of folks due to that. And so this is looking at a different model, a model that's been used in Europe. It's being used around the United States. It's more of a mid-sized type of facility. And so it's a study committee to look at that and consider those kind of options and really make sure that the knowledge of that is out there and draw attention to it. And I'm going to sort of turn it over to Deborah Stokes, say a few words.
Thank you, Chairman and members of the committee and Representative Hawkins. This is a co-age priority, the Coalition of Advocates for Georgia's Elderly. Every year, co-age comes up with 5 legislative and budgetary priorities that represent the interests of its over 1,200 members across the state. Every year, we go through a pretty rigorous process to determine what the most important issues that are being faced at the time with our elderly citizens. So this is a co-age priority, and it's been discussed and vetted, and we bring it as we do every year to see if we can get additional information and assistance from the legislature in addressing the issues. We have 2 of our co-age and Georgia Council on Aging members. The chairman, Vicki Johnson, would like to present via Zoom, and the advocacy partner, Carol Hanlon, from the Wisdom Project, would like to do a brief presentation, if that's okay. Great.
Ms. Johnson, if you can unmute, we'd be glad to have you participate in the hearing. Vicki Johnson.
Yes, I can do that. And do you want me to turn my video on?
It's all good.
Okay. Good afternoon, Mr. Chairman and committee members and Representative Hawkins. I'm Vicki Johnson. I'm the chair of the Georgia Council on Aging and the chair of COAGE, which is the Coalition of Advocates for Georgia's Elderly. As Deborah has just presented, this resolution resulted from selection as a COAGE priority for legislative action this year. Our 1,200 members selected this from among a group of issues that impact older adults. We concluded that it would be good if there could be a legislative study committee about opportunities for nursing home modernization. I'm going to be very brief in my remarks. During the past 2 years of the COVID-19 pandemic, we have seen its severe impact on our nursing home residents, staff, and owners. The cost has been measured in lives and also in financial losses within this vital industry. This COVID pandemic will not last forever, but the lessons we have learned can help guide us. We have many excellent nursing homes in Georgia, yet there is support for moving in the direction of modernizing nursing home facilities and care models. So let's take a look at what opportunities there might be to help. This study committee could explore options and discuss whether there is a role for the state to help move in that direction. The population of older Georgians is growing, along with the prevalence of debilitating illnesses such as Alzheimer's and related dementias. We anticipate that the demand for skilled nursing home care will increase, but we are concerned that current nursing home models may not necessarily position Georgia for new opportunities. A study committee could provide an in-depth look at options for our state. COAGE recommends your favorable consideration of HR 768. Carol Hanlon from the Wisdom Project 2030, which is the group that brought this issue to COAGE, is here today with information about some of the benefits of nursing home modernization. I want to thank you for providing us this time. I know your day has been long, and I appreciate that you gave us this opportunity to speak in favor of the resolution. Thank you.
Ms. Johnson, thank you for being with us today. We can segue into Ms. Hanton if you're ready to go. Carol Hanton, if you can join us.
Absolutely. Yes, thank you very much. My name's Carol Hanlon, and I represent a senior leadership organization in Hall County called Wisdom Project 2030. We've been exploring ways to offer our residents a modern model of long-term care since 2016. And I thank you for the opportunity to speak with you today in support of House Resolution 768. Despite an innate desire to age in place, many of us will find that we need to have skilled nursing or long-term care for ourselves or a loved one. The study committee proposed in House Resolution 768 seeks to explore opportunities to expand long-term care options based on proven modern models. First, I would like to just share what these models look like. Imagine being greeted at a residential front door, passing through a foyer, and entering a home's great room. It looks like most of our homes, with comfortable furniture, a fireplace, and some residents watching TV. On one side is the open kitchen, where you can see a staff member working, and you can enjoy the smells of either lunch or dinner that's cooking. Some residents are gathered around a dining room table that's large enough for everyone to sit at, working on a jigsaw puzzle. And down the hallways are 12 private bedrooms, each with a private bathroom. Just out the back door is a private outdoor patio and garden. It looks like home. Imagine a place where the daily rhythm of life also feels like home. You can wake when you want, eat when you're hungry, and spend your day as you wish. Staff members cook the meals, often using residents' favorite recipes. They also do laundry and light household cleaning. The residents can help if they want, or just keep the staff members company as the chores are being done. Activities and celebrations take place with visiting family members or guests. Mail and groceries arrive. It feels like home. These models of care offer many benefits. Studies have shown clinically significant improvements to health, reduced Medicare medical costs through fewer hospitalizations, and reduced Medicaid costs by helping residents maintain their overall functionality and requiring less assistance. Residents of these homes that operate this way also report high satisfaction with a quality of life, which is echoed by their family's satisfaction. These homes also experience lower staff turnover and higher job satisfaction, affecting both the quality of care delivered and staffing expenses. These homes nationally have a higher mix of privately funded residents, which is key to balancing operating revenue. Higher occupancy in these homes also positively affects revenue, with rates remaining above 90%, even following the worst of the COVID pandemic. Studies show that infection rates in these homes during COVID were half those of traditional nursing homes and deaths less than 30% of the rate sustained by traditional nursing homes. I would like to close by saying that you don't really have to imagine these homes because they already exist in small numbers across the country. What we hope can be achieved with how this care option for senior Georgians. Thank you very much.
Thank you very much for being with us. Are there any questions for either presenter from the committee? Thank you for being with us. Sorry, we have one question online from Chairman Knight. You can unmute and go ahead with your question, sir.
Thank you, Mr. Chairman, and appreciate my friend Lee Hawkins and bringing this. Let me make sure I understand this, because what you're doing is so very important as we again continue to look at how to handle our aging demographic, and as somebody who's dealing with aging parents, this is very, very important. My question is this very much narrowed into looking at a certain model or all models in the study committee?
My understanding, the title is a House Study Committee on Expanding Long-Term Care Options. And when I checked on that same question earlier regarding the bill, I was told that they will look at many models. This happens to be one that they particularly want to look at, but I don't believe it's restricted to that. Is that correct, sir? Right. It will look at all different types of models of long-term care options.
And Mr. Chairman, one follow-up question, if I may.
Certainly.
And if we're doing that, if we're going to do this study committee, and I'm not sure again of the total makeup, but I would hope that we'd also look at again other models and maybe have make sure we have a committee that a study committee is made up of maybe home health care, community-based type solutions also on that. And again, I'm very much in support of what we're doing here. So very important to Georgians, especially Georgians who are later in life, and to make sure we keep that quality of life up for many of our aging Georgians.
I do believe that is the plan. 5 members of the House of Representatives will be appointed by the Speaker to be on this committee, but I'm certain meeting with significant advocates of multiple options are going to be an integral part of what the study committee looks at. Madam Chair.
David, this is mainly the long-term care options. It doesn't do away with home health care at all, but even the president said that nursing homes, because of the high death rate and the incident of infections and all what had been found during COVID, that they needed to move to new models like private rooms and different things. So, I think we have lots of different avenues, but right off the bat, the most critical one is to look at what we need to do to make sure we never have the same problem that we had during COVID, and that our seniors who need nursing home care have a more satisfactory experience.
Thank you, Madam Chair. Whip Hatchett.
At the appropriate time, I'd like to make a motion.
I believe this is the appropriate time unless there's any other discussion. Yes, sir.
I move to pass.
We have a motion to pass. We have a second. Any other discussion from committee members? Not. All in favor say aye.
Aye.
Any opposed? No. The bill passes. Thank you very much, sir. And with that, the committee will move on to Chairman Jaspers. Thank you for being here with us with House Bill 1371. If you can go ahead and present your bill, just read your LC number if you don't mind.
Thank you, Chairman Newton. LC 540064S. Hope you have.
Wait a second. Sorry. Apologize. Let's
There's a substitute?
hold just a moment.
We don't have it.
No.
We have 540051.
Yeah, you got the original. Well,
Can we start and then as we get copies, go to the part
Oh,
that's
sure.
changed, or is there
It's just a minor
significant
change.
differences?
I can explain the change.
Are we getting some copies? Okay.
Do you want me to-
Yeah.
We'll
there
go
is
make some
it's a
copies
minor
of the
change.
changes, but if you can,
Sure.
go ahead. Thank you, sir.
I'm sorry. Thank you, members and of this committee. I know many of you are on the Rural Development Council. And as you know, we look at issues facing rural Georgia, all over our state. In both of the committees, health and this one, we look at all sorts of ways to reach out, attempt to fix the issues that are brought for us to see. This bill addresses what we saw. Before the pandemic, we saw workforce issues all across healthcare. And as you know, the pandemic made it worse. And I think we could easily say that no part of healthcare workforce has had a surplus of workers. This Rural Development Council proposal proposes the creation of the Rural Health Advancement Commission. Its purpose shall be to develop private sector solutions to address short and long-term healthcare and workforce solutions. The proposal before you puts together a commission of 13 members. As you'll see, you get it on page 2. It's on the original too. Why 13? That's been my question that many have asked me. You just have to limit the number, just to make a committee that is easy to work with, so it will get a lot done. I can't imagine, I have been asked by many to be a part of it, but I'm sure that the composite makeup of this group will ask and investigate all who come before it. Most of the bill is just about rules, about who, what, how much. And so in our idea, what it can accomplish is help to direct state and private dollars in education to the most needed areas where gaps are in training that's out there, and identifying health needs and solutions for rural Georgia. And this penny's got my good one here. One with all the scribbling on it. And if you look at it on yours, I'm trying to remember one thing I changed. I think the only change between yours and mine is originally on line 25, and then another one I had a health insurance provider in 2 places in the original, the one you have, and a 31. And so we changed that one, 31B, to a chief executive officer of a hospital that serves a rural area. And so you see it's very broad, it across the range. It appoints the speaker, will appoint the leader of it. It's a Rural Development Council that he's been the leader of for many years. Lieutenant Governor, appoint physician. It just goes on right down through there. Also appoints 2 members, a member from the House and the Senate. And we thought was very important so that, that communication between what these folks do to us is going to be very seamless and quick. And, they do appoint for 2 years, can be reappointed. I think that's very important. So there's continuity. So you're not having people having to learn something new every time. And I think that's what is one of just little differences in this commission than many others. But the only changes was that is on that insurance. I don't know how we did it, but we put insurance health providers twice, and I don't think any of y'all would want for me to do that. That's it.
Thank
That's
you,
my
sir.
bill. We'll try to answer questions as you
The
get.
Rural
through.
Health Advancement Commission. Are there questions for the author? Representative Prince.
Thank you, Mr. Chairman. And I know 13, going back to the number of folks on there, you have to limit the number somewhere.
Sure.
Question of, did we consider, because this is like a workforce development type thing, or sort of examining that, someone from the Department of Labor as a part of this? And I know its focus is on
Thank you.
a lot of rural health stuff, but
Well, I thought-
they may be able to help as a part of.
Bill, thank you, Representative. And Ms. Penny's here said technical school also, they'll bring those in. Those are state agencies that's their job. I'm sure they will bring those in to ask a question, to ask why they're not doing this or what the gap is. Many times it's money to make sure we have adequate teachers, especially at TCSG. I have a different bill to try to address the payment of some of TCSG's employees, especially in the nursing field or in the welding or wherever, that they can't hire people at a rate that they can't get in private industry. And we have some classrooms that are closed. So that's another thing I'm working on the side.
Thank you, sir. No more questions from, let's see, Chairman Knight, did you have a question online? Possibly not. I know we have some signed up to speak. Tim, if you could join us right there, pull that microphone around, if you will, and say number 2 on it.
It says number 1.
Number 1.
Number 2 is.
No, number 1's good. Number 1's on now. Thank you for just let everybody online know who you're with, and thank you for joining us.
Yes, sir, Mr. Chairman. I am Tim Kibler with the Georgia Alliance of Community Hospitals. We are a 92 hospital association of Georgia's not-for-profit hospitals, and very much appreciate the work that the Rural Development Council and Chairman Jaspers have done to bring forward this workforce initiative, particularly the concept that this is going to be something that's ongoing. So many times we try to get a problem solved in a single year, and unfortunately, this problem is much too large to be solved in a single year. We do greatly appreciate the appropriations committees and the funds they are putting into enhanced educational opportunities, instruction opportunities for workforce throughout the healthcare arena. And I have mentioned to Chairman Jaspers one little thing, that we do feel like this is not a rural issue, it's a statewide issue. And I know, Mr. Chairman, you understand that, and Chair Lady Cooper understands that better than most in dealing with the vast array of healthcare issues that you face. But we think this is a great direction to go in, and to bring the academic instruction, the employers, and the professions together to try to make sure we have the workforce to meet the critical shortage that we're facing right now is absolutely a priority, I think, for all of us. And we commend this measure to you, and thank you very much for the time. Be glad to answer any questions should there be any.
Are there any questions for this? Thank you for presenting, and thank you on behalf. You can pass along, please, our gratitude for those rural hospitals serving in challenging areas, but making a huge difference in the lives of Georgians. And
Yes, sir, Mr.
thank you for how we can work together.
Thank you.
Are there any other questions? There's no more signed up to speak on this legislation to develop the Rural Health Advancement Commission. I know you did mention, I know, Mr. Kibler, you mentioned this is a multi-year process. It's anticipated. I know in Chair Lady Cooper's committee yesterday, she and the speaker both discussed the fact that our mental health challenges that are also great we can get here overnight. We're not going to get out of it overnight, but I think this commission sounds like an excellent and strong first step. Chair Lady Cooper.
At the proper time, I'd like to make a motion.
I think now would be an excellent time.
I move that we do pass House Bill 1371, the substitute 540064S. So it would be the substitute to House Bill 1371.
All right. Thank you for that motion. Is there a second? We have a second. Any other discussion from the committee? If not, all in favor, say aye.
Aye.
All opposed? Love the delay. Any others? No. The bill passes. Thank you very much, sir.